Good evening, everyone. Oh, yes, I love that. Good evening, everyone. My name is Naja El Mohammed. I am the Director of Alumni Relations at Silver School of Social Work. And on behalf of, there's a lot of us here, on behalf of NYU Dentistry, Grossman School of Medicine, the School of Global and Public Health, Roy Myers College of Nursing, and again, the Silver School of Social Work. Whoop, whoop. I would like to welcome all of you to this event. It is my pleasure to introduce Dr. Deborah Albert. Sorry, I can't see her, the podium is a little high. She is the Senior Vice President for Patient Care Services and the Chief Nursing Officer at NYU Langone Health. She is going to give us a special welcome on behalf of NYU Langone Health. Let's give her a round of applause.
Well, hi, welcome everyone, good evening. On behalf of the entire NYU Langone leadership team, it's really my honor to welcome you to our organization. If it's your first time here, I hope that you enjoy the space and that it's conducive to your learning process. It meets your needs. If you're returning, I'll simply say, welcome back. So happy to have you here. I'll tell you, we're really just thrilled to host all of you and this amazing group of thought leaders that we've gathered here tonight for the panelists, innovators, clinicians, researchers, and educators, but all bound by the shared common goal of harnessing AI to improve lives. And so with that, I have to tell you, it's so fitting that the planners and sponsors of tonight's event chose this location for such a discussion. If you know anything about Langone Health, you know we are relentless in our pursuit of ever-improving quality, safety, and excellence in clinical outcomes. And so we know that harnessing AI is integral to that pursuit. We use this tool to streamline our workflows and empower our clinicians. We use it to help in clinical decision-making, accelerate discoveries, and advance our nationally recognized medical education programs, I think some of which you might hear tonight. We've deployed over 150 AI models now across our institution. And building on our growing expertise, earlier this week, we actually held our first AI in Healthcare Symposium. And so more and more, AI is becoming integral to Langone Health and the way that we provide care and what we do. Our leadership team, spanning all three aspects of our tripartite mission, education, research, and patient care, is deeply committed to ensuring that AI enhances, not disrupts, the human connection that is at the heart of healthcare and caring. The work is not siloed. In fact, it's collaborative and multidisciplinary, and it's deeply rooted in our values of safety, equity, and excellence. And so, like all of you, I know that the comments and insights shared tonight will enhance that journey, and so I'm so eager to learn from them and hear the information that they have to share with us as we all continue on the journey of harnessing the power of AI and technology to serve humanity. Thank you so much.
Thank you, Dr. Albert. It's now my honor to introduce the moderator for today's program, Dr. Leila Jahangiri.
Thank you.
She's a clinical professor and Ira E. Klein Chair of the Department of Prosthodontics at NYU Dentistry. Yes. And I'm going to turn the program over to them. Thank you so much.
Thank you very much, Naja. Good evening, everyone. Thank you for joining us here at NYU Langone for what promises to be a dynamic and an important conversation on AI in public health. This conversation is between the alumni of 5 schools, as you already saw they're mentioned. I am very lucky to be the moderator. It's my pleasure to moderate the discussion this evening because we have superb panelists here. Artificial intelligence is no longer a futuristic concept in health. It's here, it's influencing how we diagnose, treat, prevent, and understand disease. Today, we're fortunate to have with us leading experts from NYU who are each shaping the future of AI in public health in unique ways. To my far right, Dr. An, representing Silver School of Social Work and Constance and Martin Silver Center on Data Science and Social Equity, is an endowed professor in data science and an internationally recognized scholar in applying AI to addressing health disparities and social inequities. Yes. To my immediate right, Dr. Chunara, representing Global School of Public Health. She uses data and computer science to improve public health. She has worked with several private and public sector organizations on their AI integration and strategy, such as New York City Health and Hospitals, the nation's largest safety net healthcare system. To my immediate left, Dr. Sadarangani represents the Rory Mara College of Nursing. Her work bridges geriatrics, community health, and AI-driven care solutions for aging and vulnerable populations. And to my far left, Dr. Triola is Senior Associate, he's foreign to this space. He's Senior Associate Dean for Medical Education, representing NYU Grossman School of Medicine and host of tonight's space. He's transforming how we train future clinicians to work in data-driven, AI-enabled healthcare system. As we proceed, and I welcome all of you tonight, it's wonderful to see all of you. As panelists, we were talking about you have a lot of energy to be here at this hour, so we hope not to disappoint you. We have set out some little learning outcomes, and as we review the learning outcomes momentarily, I also want to describe how the evening will go tonight. We're going to spend about half of the evening having some panel discussions. And as the panelists are speaking and having their discussions, you can formulate your own questions because the second half of the evening, we're going to come right back to you and open it up to the audience. We will have 2 microphones in the aisles placed so that you can, what happened to the mics? Did they move? Oh, you moved them back. Okay, but you move them forward. Okay, at some point. I'm going, that's not where they went. So we're going to have the mics, so line up and we will address those questions. So, but we want all of you to engage, challenge, and contribute to the dialogue tonight, and let us begin. Dr. An, if it's okay, I'd like to begin with you. And here we go. The first thing that I'd like to know, or I think the audience should know, is what is the difference between automation and artificial intelligence? And in your opinion, why is it important for all of us to understand that there is a difference, especially as it applies to public health applications?
Yeah, sure. This is a great question. I know there's a lot of confusion probably in this room and for all the classes I'm teaching regarding the difference between automation and artificial intelligence. So in a nutshell, consider that you have a calculator, right? When you type 1 + 1, you always get 2, no matter how many times that you use the calculator, because the result is deterministic, right? In this case, it's not really driven by the probability, and we have a simple automation, right? And sometimes when we do repetitive work, we just want to make sure that the system works in the most robust way, reliable way, and repeatable way. In this case, well, automation is great, right? Because it gives us a reliable outputs. On the other hand, a lot of time, we are looking for some kind of cognitive functioning, right? When you want to make a decision based on complex factors, and you need some kind of reasoning to ensure that your decision is on the fly and based on the facts provided, right? In this case, automation is not enough, right? And you need artificial intelligence. For example, you can use calculator to do the calculation, but how about if you want to explain this to a self-learner? So the AI will be able to help because AI can customize the message, right? Explain the math to an undergraduate student versus explaining the math to, say, a high school students or primary school students, right? It's going to use the different language customized to the listener. In this case, we need cognition, right? We need some kind of intelligence to make decision and provide customized answers, right? So in this case, artificial intelligence is a must-have because we need human cognition, right? Human-like cognition. And for public health, we need both automation as well as artificial intelligence, right? Because when we are handling a lot of repetitive work, we want to make sure that 1 + 1 always equals to 2. In this case, yes, we can use automation to greatly improve our productivity to ensure repetitive work can be handled reliably. On the other hand, for example, when we try to predict a new disease onset, when we try to identify at-risk population, when we try to design customized interventions to address consumers' needs, in those cases, we need a lot of intelligence because we need to make sure that whatever comes from our study, from the product, can be customized, can take into account differential human demand and build that into our solution.
Thank you so much. With one quick interruption, Andrew in the back, could you set our clock for us? Thank you, just because we want to stay on time. Thank you so much. Dr. Triola, I know you've led a lot of innovation in medical education. How do you see AI changing medical education, not just in classroom, but also in a clinical setting?
Well, I think that AI is going to transform all education across the entire vertical, from kindergarten and beyond, across the world, and for every student, no matter their means or their needs, just as was said. And so I think this is going to be something that's going to be a very exciting democratization of access to high-quality teachers, high-quality expertise to everyone in the world. On the medical school side, as you heard from Dr. Alpert, we're really reinventing the entire NYU Langone organization around the opportunities that AI affords us. We've passed the tipping point that AI will transform not only our society, I believe human civilization, but certainly healthcare in the United States. And so part of it is, when we think about AI in education, is how can we use AI to teach better, and how can we teach differently because AI is transforming the world into which we are sending our graduates. And so I think that on the second point, that's true for all of the schools represented here, that our students that we are teaching now will be entering a world that will be altered in some way by AI. I think improved. I'm a huge AI optimist. But they're going to have different skills. They're going to have superpowers that none of us ever had in their ability to do a good job in their future. But these changes will be disruptive, and we need to anticipate them. In terms of using AI to improve the way we teach, we're really embracing the opportunities of what we're calling precision medical education. And it's similar to what my colleague just said about using AI to meet the needs of each individual student in a customized way. Imagine being able to tailor the curriculum, the assessments, the evaluation, the exam prep for every single student to exactly what they need based on their performance all the time without requiring huge amounts of faculty or others to help do that. And AI makes that possible. Two quick examples on the medical school side. Our medical students are seeing patients in the hospital. It's a core part of their education. We've built an AI system that looks into our electronic health record all the time. And when a medical student picks up a new patient, the AI figures out the diagnosis of that patient, goes into our medical education systems, finds the matching resources and self-study questions that would be the best fit for that student for that case. Then the AI goes out into PubMed and does a literature search and chooses 2 articles that it thinks that medical student would benefit from. The medical student then gets an automated email that the AI wrote to them saying, hey, you just admitted a patient with heart failure. Here are some resources, here are some self-study questions, and here's a recent review article and a recent guideline paper that might be of benefit in your learning about this case and your management of that patient. So in that way, we're using AI to deliver tailored education to the needs of each individual student. My second example is that, like many of the learners in our programs, our medical students write a lot of free text notes in the electronic health record. The notes vary by our different specialties, but it's the same concept. And like your students, our students get feedback on very few of those notes. They write a lot of them, they get feedback on just a handful from faculty. And so we've built an AI system that goes in and reads all of the clinical notes they're writing, applies a rubric, analyzes the note, and gives them feedback on the quality and quantity of clinical reasoning that they're expressing, and tracks their progress over the 3 years of medical school as they get better, giving them real-time feedback and dashboards back to our faculty to have a snapshot of all of our students and the ability to zoom in. None of this would have been possible without the opportunities that AI affords us. So I think the future is limitless.
Don't you all want to go back to medical school? I thought you may. Thank you very much. Dr. Chunara, so what do you think are the big challenges seen in existing AI deployments, and how can we avoid them?
Great. So thank you, Leila, for hosting and for having me at this conversation. It's quite exciting to be here. So we've heard a lot about really great opportunities around artificial intelligence. Today, we do have artificial intelligence under the hood in many stages of the healthcare experience for all of you. You might not even have realized it. So all the way from at a hospital system level, trying to predict maybe where there will be empty beds to better plan health services, if a specific patient might readmit to the hospital, and also when we converse, maybe on some of the messaging with our healthcare providers, there could be generative AI behind that as well. So there's many places where today we are already seeing AI under the hood, and that means we've had the chance to take a look at how it's working. And so, given a little bit of visibility I've had into different health systems and these kind of deployments, I can say a few things to share with you here today. We do find that how this works, so meaning how well that prediction is or how good that text conversation is does it have any negativity? Does it get things wrong? We do see some challenges in terms of specifically across different racial groups, specifically in the United States. We also see differences across kinds of insurance that people have, private versus public versus having no insurance. And so these are areas that healthcare systems are now looking at. Well, why is this happening? Of course, just like any algorithm, any recipe where you put in the ingredients, you put in the data to get your final chicken soup or samosa, if I may, it depends on the quality of the ingredients. Are they capturing what's needed for everybody, right? So it's coming down to taking a look at what's under the hood. And not only how it's built, but also do we have the right ability to test everything once once we're on the other side? Are we asking the right questions? And this is where we need a lot of input from folks like you as well for us to be able to make sure everything's working well for everybody.
That's wonderful. Dr. Sada Rangani, she's developed an app, famous person. Tell us about your CareMobi. It's an app for adult day programs.
Yeah. So let me start by saying that I want everybody in this room to think a little bit differently about where healthcare takes place. I know we're here at NYU Langone, but I want you all to think about the fact that 99% of healthcare actually takes place outside of this building. Healthcare happens in our communities. It happens when a kid goes to the school nurse. It happens when they go to the pharmacy to pick up a medication. It happens when they have a home health aide in their house. In my setting, I happen to study these adult daycare centers, and many of you are probably like, isn't that a bunch of old people doing dancing and dominoes? And you're not wrong. I mean, that is the public's perception. But these settings, which exist throughout the country and in many here in New York City, are really highly effective platforms for chronic disease management. And so if you think about the average patient visit in this country with the doctor, on average, it's 18 minutes long. But these community settings see these people 3 to 5 days a week. And when you have older people who have a dementia, who can't advocate for themselves and don't present like a typical patient would, they don't come to you and say, hey, I have a fever, I'm not feeling great today. They might be confused. They might not be acting like themselves. These centers know these individuals. They have a wealth of serial observations and data on these people that never, ever leave their centers. And when there's a problem and they recognize that, they don't have a great way, as my research has pointed out, to communicate that to doctors. It often hinges on family members and family caregivers. And so we created a mobile app recognizing that these are very resource-limited settings that don't have the Epics and the Cerners and all the fancy things, but they have a wealth of information that if we had access to that and could help them make sense of it, we could say, hey, you know what, Mr. Smith, you're right, this isn't his normal dementia. He might have a urinary tract infection or pneumonia or something that requires medical treatment. And so we created this mobile application called CareMobi that allows family members to create a care team. They can invite their home health aide, they can invite their adult day center, they can invite their sister in Chicago, whoever is involved in this person's care, and they can exchange information about their loved one's day-to-day health. And as we continue to add components of artificial intelligence, we can now start to make better decisions about, does this person need to go to the hospital? Is there something brewing? We can help caregivers throughout communities make better decisions about their loved one's health.
That's great. I have a follow-up question. Yeah. Is this for the day programs to use it themselves, or is it for you to gather the data for future to make it available to all programs?
So anybody right now, if you were to go into your app store on your phone right now on Apple or Android, anybody could download this. But many of our users are adult day programs, home health agencies, others, people where, as I said, healthcare is taking place, but not looping in. We also have ordinary family caregivers who are just like, how do I take care of my mother when my sister lives here and I don't know what her aide said? And so they can download the app and create a care team, but many of our users are also adult day programs, home health agencies that onboard their caregivers, and then their caregivers can, get updates. Because, and Dr. Gennaro knows this as well, when you send your child to daycare, you get a million pictures, you know who they've played with, you get a ton of what they ate, how they slept. You send an adult to an elder care facility, there is zero transparency about what happens in these settings. And it is so important to have that data, because when they present to the hospital to see a clinician, and the doctor says, well, how have you been eating? And how have you been sleeping? And what's been going on? If there's 5 caregivers involved and nobody knows the answer, then the clinician doesn't have the right data in front of them to make a good decision. And so combining the caregiver information, the information from these settings, and with the support of artificial intelligence, we can have better data to help us make more informed decisions.
Thank you. Dr. Triola, how do you think we can create feedback into the system, a loop to improve patient care, community health, and medical training?
Well, I think we just heard a fantastic example of exactly that. And I'll give another example that is an emerging form of AI that we're really finding very compelling, and that is this concept of ambient. So AI up until a year ago has really been about text. You upload some text and ask it to translate it into French, or you ask the AI to write a sourdough bread recipe. And that was a text-based interaction. But increasingly, the AI models now can understand spoken language, music. They can now understand video and what it's seeing. And healthcare is very much a multimodal human interaction space. And so we have been deploying across both the physician and nursing side this concept of ambient, where when a physician or nurse is interacting with a patient, The AI is listening to that conversation in a secure and private way. I want to emphasize that. But the AI is listening. The AI understands who's speaking. It knows who the healthcare professional is. It knows who the patient is. And as the conversation is happening, the AI is in real time transcribing not just what is said, but beginning to write the note as the encounter is happening. And so in a perfect world, at the end of that visit, the AI will have used the ambient audio of the conversation between two people, and this could be in an adult daycare setting or a healthcare setting, to synthesize and understand the meaning underneath that. The next phase of this will be that the AI is a participant in that interaction between the doctor, nurse, or the patient. And the AI could chime in and say, remember, you didn't ask about this, or, hey, you were thinking about doing that, but this patient is on anticoagulants, and provide real-time decision support and feedback. This means that the decision support that goes into so much about care no longer needs to be bound to that hospital or that clinic room, nor does it need to be bound to interacting with text or things on an app screen, which are difficult for many patients. It could just be a normal conversation that people have with devices or sensors. And so I think that this concept of using ambient listening and vision, using the underlying data that we're routinely collecting as part of the healthcare system, will now enable us to not only turn healthcare from being episodic to real-time streaming, but enable us to derive insights and care decisions on top of data that is so vast that we just don't have the workforce to look at it as humans.
That's wonderful. So I just learned this week that in dentistry, obviously an obvious public health thing that all of you do is brush your teeth every day, I hope. And I learned that there are going to be AI-driven toothbrushes. It was discussed by one of our colleagues, Vivek Shetty from UCLA. They actually had an NIH funding data from 5-6 years ago to gather what are the proper habits of doing it, with what pressure, for what duration, and what areas, etc. So with that ambient voice, I can imagine my toothbrush is also going to be talking to me. I'm not sure I can take all this feedback. But it's true, and it's going to be happening, and it's going to be affordable, and especially for people that maybe don't have access to greater monitoring of the disease and stuff like that. And in dentistry, one of the other great innovations recently has been with diagnostic sciences, in radiology in particular. So it's one thing to sort of diagnose the disease, either periodontal disease or decay, otherwise known as caries, but over time it can predict disease progression. And in younger adults, it can disease craniofacial growth. Say somebody who's having orthodontics. If you or your children or your siblings had any orthodontia or seen with Invisalign or aligner technology, all of that is AI-based. All of that is, they have been having the data for many, many years, so now at a click of a button, that's why on the phone you can get your aligner technology delivered to your door, because they have all the data, so it does make it more accessible. Dr. Ahn, we're going to come right back to you. And I want to hear from your expertise, what is a misconception about AI? What is it that we think AI can do and we're wrong?
Yeah, great question. Thank you, Leila. So for the years I'm teaching and doing research in AI, using AI, I observed a few, I would say, several misperceptions that people take for granted, but actually are not true, or with a restrictive condition. One is sometimes researchers and so students will come to me and say, well, there's a phenomenon I observe, or there is a complex case that I don't know how to solve, and do you think AI would be able to analyze this and give me the answer, right? Or being able to classify it, categorize it, and interpret the findings. Usually I would say probably no. Because think about AI is just mimicking our human cognition, right? So we need to have some kind of understanding of the phenomenon, of the cases, and then we teach AI to do similar things, right? To function about the same. Sometimes AI get the idea, sometimes AI doesn't get the idea, but it would be really rare for AI to be proactive and solve something that we don't know how to solve ourselves, right? Because we human as the expert, we are trained the AI to do similar cognitive functioning and reasoning. So at least for now, I don't think it's realistic for us to expect AI is going to go ahead and solve something that we don't even comprehend. So another misperception is that AI is more objective than human being. Right? I often hear people say, well, no, if we adopt this AI solution, it's going to be less biased than people because no, AI doesn't have a conflict of interest per se, right? But that is simply not true because we know garbage in, garbage out, right? Bias in, bias out. So because the AI, if this AI model is trained based on biased data, or unrepresentative data, right? For example, no specific group are less represented in the model, in the training data, then the model is going to be less accurate in predicting health outcomes for that particular subgroup, right? So in this case, there's implied biases in the data or unrepresentativeness in the data that translate into AI outputs. So from that perspective, I won't say AI is more or less biased than human being. The third misperception pertaining to the idea that if we use more data and then AI output are going to be generally better. So a lot of time it's really the qualitative data that we train the model rather than the quantitative of the data. But it takes a lot of experts, time, and resources to really build a good ground truth, a data set that we can train the AI model. Right? So therefore, we won't able to, a lot of time, we just don't have the resources or don't have the ground truth to supervise the model and fine-tune the model so the model can predict something that is fundamentally useful. And the final misperception is AI demands a lot of data and a lot of mathematics, statistics, and programming. So it's a lot of social scientists, students from public health, from social work, from social disciplines tend to stay away from it. I would say this is the first time in human history that we can communicate using our own language, not machine language, right, to teach AI to work with us. Right? So this is a once-in-a-lifetime opportunity. Now the barrier is much, much lower than before. So you won't need to be a master in statistics or mathematics or data science or programming. There are plenty of tools now already for you to build complex agentic AI systems without a single line of code. Right? So the barrier is lower than ever. But this is, I would say, a perfect time for us, no matter what discipline you have come from, go into and learn about fundamental of AI and leverage AI to be more productive in your work and research.
Thank you very much, Dr. Sararangani. You've worked closely with policymakers and agencies like USDA in developing AI to improve nutrition in community settings, as she said, in older adults. How can AI tools generate data or the kind of data and insights that drive smarter policies?
Yeah, so I'd love to give you all an example of some work that was recently funded for me by the NIH. In these daycare settings that I work with, everybody gets the same meal, regardless of their need, regardless of their age, regardless of their chronic conditions, their dentition. A meal is put in front of them. That meal is critical for some of these people. It's probably the only meal that 35% of them will eat in a given day. It's important that it is comprehensive and meets their nutritional needs. But the people working in these settings don't really have that information. They're supposed to just follow USDA guidelines, which are really designed for people 18 and over. And somebody that's 80 years old, that's frail, has very different needs than an 18-year-old. And so while we have these wonderful taxpayer-funded nutrition programs that are designed to feed people, are they really providing them with optimal nutrition? And do we have data even that they're actually doing a good job? No, we have data that we're offering a meal, but how much do they eat? Are they getting the nutrients that they actually need to optimize their health? And so this recent project that we're working on uses artificial intelligence to snap a photo of the meal that they're eating in their day program. And based on inputs about the individual that, a dietitian who these centers can't frankly afford to have on staff might put in, it will say, okay, it looks like Mr. Smith's meal has 10 grams of protein, 5 grams of fat, whatever, 1,000 calories. And then based on Mr. Smith's inputs, this meal should really have 20 grams of protein and 10 and 8 grams of fat or whatever it might be. And so it uses artificial intelligence to provide them with better recommendations and guidance on how to not just serve everyone a meal, but to optimize their nutrition and optimize the meals that they're receiving. And so this is really an important point because currently the data that we have is about utilization metrics, what people are being served, but it's not actually looking at how it impacts their health. And so AI really presents us with a great opportunity to measure this more accurately in simple, cost-effective ways we've never been able to do before.
And the photo alone will kind of tell you what you got?
Yep.
So we can tell all the youngsters that take pictures of their food that, hey,
Yes.
check out the nutrition
It's
too.
all the TikTok rage.
Okay,
yes,
we
guys,
got
that's
it,
what
we
next
got
step.
it. That's good, that's terrific. Dr. Chinara, what do you think are the important skills to learn for someone working in the future of public health?
Sure. So I'm happy to speak to this, especially having worked with a lot of organizations like our Department of Health, our New York City Health and Hospital System, Langone System, and understanding what kind of workforce they have and what they're looking for as well. And first of all, I want to share a little bit that we all know that today, lifelong learning is really important, right? So even since I became a professor 10 years ago, the landscape has changed so dramatically. We didn't have the computational capabilities to run deep learning models very easily. Nowadays, that's taken so many times faster, and we are able to do things like generative AI. So the landscape is changing rapidly, and that rate of change is increasing as well. So keep your minds open. You have got great foundation here at NYU, but we're always now looking to keep learning. And the picture used to be where you'd have one position and stay in that for a long time has now changed a lot, where there's a lot of more fluidity. And when we're looking at AI deployment specifically, our organizations are really looking for people who have some understanding of what's under the hood. We need people who can take, whether it's off-the-shelf black box algorithms coming out from Epic or in any of the electronic health record makers. We need people who can take those and not just understand what's happening, but also, like I spoke about earlier, evaluate. Is that going to work for our setting? How do we stress test this? How do we make sure this is going to be applicable? And that takes a lot of skills, all the way from knowing about coding underneath the hood, knowing about how algorithms work, all the way to having an understanding of population health. What are the populations that tend to be disadvantaged that we need to pay attention to? What are the frameworks around workflows, around new technologies in a healthcare setting? How do we work best with the community to share about this kind of information? So there's many, many layers of folks who need to be at the table working together on AI today.
Thank you so much. We're going to take a pause from our panel. We can always come back to the panel, but I'd love to have some audience members to bring questions. We're going to have 2 microphones lined up in the aisles, and I'm going to encourage you to use the nutrition that you just got to get the juices in the brain going, have all the questions that you have for our panelists, and as you begin to formulate your questions and as you come up, I see everybody's fighting to get out, so, but as you come up, please introduce yourself and kindly tell us which school you're coming from or you're representing, and limit it to one sort of a simpler question. Don't have a nested question because that could complicate things. And if the question is for a particular individual on the panel or for the entire panel, and then we can figure out who can best answer your questions. And you're on, ma'am.
Yolanda Laguerre, I'm with Steinhardt, Education, Communication, and Technology.
Welcome.
Thank you. So I'm all for AI, particularly in my field for teaching, learning, cognition, and assessment. So Dr. Tavola, what you're saying, all for that and all the work you're doing. But I'm concerned about the dangers of AI, particularly in self-diagnosis. With the rising cost of healthcare, people are using AI to self-diagnose. So that's a danger that I see. I'm wondering if you could speak to that. And also what Dr. Tavola was saying about the ambient. I have HIPAA also concerns about that. Like I've turned off my Echo and my Google at home because it picks up conversations. I don't know where it's going. So I'm wondering if you can talk to that.
I'll talk about the second one first, because that's actually easier to tackle. And you should be concerned about data privacy and confidentiality. If you're using public ChatGPT or Google Gemini or Anthropic Claude, you're giving them data that they want to incorporate and use to train future models. These are data companies. When you're using AI that is provided by a trusted healthcare system like NYU Langone, that is HIPAA compliant AI. So all of the AI that we use here at NYU Langone is private and internal. Those models that Dr. Alpert was talking about, many of those are running inside our data center. The data never leaves. And actually, data security, privacy, and confidentiality is among the easiest problems to solve when it comes to AI, believe it or not. But it's two ends of the spectrum. It's companies that are really looking for your data to improve their product and be mindful about giving them your personal health information. And then it's places like NYU Langone that are going to give you trusted, safe AI where we are obligated and committed to protecting your data. To the first question about the dangers of AI in terms of misdiagnosis, whether this audience knows it or not, the AI has, as my colleagues have said, AI has moved fast and is incredibly powerful. In study after study, when given a complex medical case, AI is better than the vast majority of doctors at diagnosing patients. AI can come up with a better management plan and deliver more value-based care than doctors under controlled circumstances. In virtually every test, they beat us hands down. AI gets a 100% on every medical board exam, better than every doctor, including internal medicine boards that I take. It's better than all the internists across the country. And so we're very bullish. We think that these systems could serve a role in accurately diagnosing patients, in helping us make accurate and more rapid diagnoses. And AI is a routine part of the diagnosis of our patients. If any of you have radiology studies like an X-ray or an MRI or CT, you're using AI to get your diagnosis now and have been for years. All that being said, there are definitely some dangers, as was mentioned, about how these models were trained. Are they applicable and accurate for a given patient population? What went into them and how well are they tested? And that's something that we had a lot of concerns about too. And so we undertook a huge effort to train our own internal models based on NYU Langone health data that we knew was accurate and trusted. And so we've built something called NYUtron, and a lot of the AI inside that we're using is trusted and reliable and accurate AI based on data that we created. It's not perfect yet, but it's a system that's absolutely going in the right direction. So great questions. Thank you.
Can I also just quickly add that I think as we teach our students, remember, we've come a long way in healthcare. It's gone are the days when doctor knows best and doctor knows everything. Patient comes in, they've already Googled their symptoms. This has been going on for quite some time. And so we've really moved towards a model of shared decision making, where the patient comes in with their perspective, you come in with yours, and we try to meet them where they are. That's what good healthcare looks like. Now AI is going to be part of that process. And I think all the more it speaks to really powerful need for shared decision making, recognizing that this patient has likely either been on Google, been on AI, and that there is a place for that and can be a positive place. But it really speaks to also the quality of relationships that we continue to maintain safely with our patients, with our families, so that we can all come to a trusted, mutually agreeable conclusion.
Thank you. You're on.
Good evening. My name is Rebecca Salant. I'm a recent graduate of Stern's MBA program and a proud employee of NYU Langone
All
Health.
right.
All right.
Thank you all for being
Keep it in the
here in
family,
this
you
very
know?
interesting conversation. I have a question. It could be answered by Dr. Trioli or anyone else who's interested, but I wanted to comment a little bit about sort of the language that Dr. Albert used and others about wanting AI to be enhancing but not disruptive. I've learned a lot about Joseph Schumpeter's theory of creative destruction and how innovations can cause temporary disequilibrium but lead to innovations and growth. And I see a true opportunity for that in healthcare, such as how Dr. Sandragani was talking about the average length of an appointment is 18 minutes, and how much of that time the provider has to spend in EHR versus interacting directly with their patient or their caregivers. And I was interested in your thoughts on the potential creative disruption of AI in healthcare.
I'll start, and then you absolutely. Our healthcare.
You start, we'll disrupt you.
Yeah. Our healthcare system is in desperate need of disruption. It is. We spend 26 cents on every dollar in this country for a healthcare system that does not meet the demand and the needs of care across this country. If you're lucky enough to be a patient at NYU Langone, you get access to incredible, full thickness, world-class, literally the best care in the country. But for many people in the country, availability and access to care is lacking, like what we heard, where there are missed opportunities. And so we're not, it's not like the healthcare system is working great, let's not diminish it. The healthcare system is not where we need it to be. Let's use AI to extend and enhance our existing workforce in incredibly clever ways, like my fellow panelists have been saying, and really grow it forward. We're not getting the outcomes or the value, except here at NYU Langone, that we want from our healthcare system, and we need help. The amount of data that's involved in every patient is already too much for most healthcare teams to handle, and my colleagues here are going to increase that by an order of magnitude or more. And so we absolutely need a disruption of the healthcare system for the betterment of our health and every aspect of the system as a whole and all of its interconnections.
Thank you for your comment.
Do other people want to comment on that? Because it's particularly... Okay.
Thank you.
Thank you. You're on.
Hi, my name is Misty Avenger. I'm a graduate of the College of Arts and Sciences from class of 2023. I was a film criticism major, but I have a vested interest in this as a young person. And my question is, an MIT study titled Your Brain on ChatGPT suggested that using AI too often can increase cognitive decline with weaker connectivity and lower memory retention. So how do you think that this and the current state of AI in healthcare will impact long-term learning outcomes and subsequently health services overall?
Go ahead.
You're right. I think...
First of all, it's MIT. Should we trust MIT?
Well, there are evidence from peer-reviewed articles identifying evidence regarding people overuse ChatGPT, not only ChatGPT, but generative AI models, and people's cognitive function tend to decline. And there are studies about radiology. Radiologists were trained years to for the diagnosis, but after 11 months of using facilitator tools of AI, and if they use the tool, their prediction is more accurate because with the assist of AI. But if we remove the AI component, we find that actual radiologist diagnosis accuracy tend to diminish significantly compared to 11 months ago. Education studies show that students who overuse AI, who rely on AI to do homework assignments, tend to substitute their critical thinking and have worse outcomes if without the help of AI. So I think it's very much a reality. We need to think retrospectively how we are going to deal with this. Right? I think two things that are really upfront and we should think deeper. One is that we cannot really go back to the Stone Age without AI, right? Whether you like it or not, AI is here, AI is more advanced, and that's a matter of fact. On the other hand, we need to be really critical about AI outputs, always exercise our critical thinking to question AI outputs. If we don't understand the terminology, if we need it to explain, you need to justify, just ask, right? And try to put grain of thoughts regarding the AI outputs, do not take them for granted. It's like if your graduate student comes with a manuscript written, and he or she asks you, can you approve it without looking at it, and we'll get it submitted? Of course, no, right? I have to take a look. I have to go line by line to check the accuracy before we can submit that paper, right? Same thing here. We cannot really take AI outputs as granted as fact. In fact, trust is a vocabulary that we should preserve for human, not for AI and human, right? So there's no blank check we should write for AI. We should be always critical and questioning, and at the same time, we should self-learn new AI technologies and try to understand the pros and the cons, the limitations of AI technology, so that we can use AI to supplement our work, but not to replace our human value and empathy and moral standards.
I also just think that it can bolster our creativity. And to the last question that we ended on earlier, when you're doing less mindless work of EHR work, insurance denials, the things that torture your mind, but can it free, I don't know the answer to this, but can it free up space in your brain to be more creative, to improve the authenticity of your encounters with your patients, with your families, with your work? Because you're not doing these things that really don't stimulate your brain, can you use that to build creative energy elsewhere? Again, I think it speaks to the need for critical foundations in learning, especially for our youngest learners. They have to learn how to, as we said, we can't trust ChatGPT, but we can use it as a tool to help us, and we need to retain those critical thinking skills.
Thank you very much. We're on to you, sir.
Good evening. Thank you so much for this evening, and thank you for wonderful thoughts. Actually, I had a two-part question. So before that, I represent NYU School of Global Public Health in health policy and management, and prior to that, I come from New York City 911 EMS within the pandemic between 2020 and 22. So when I think about AI, and especially multi-language models or agentic models, I'm always thinking when I speak to my patient, or when that call drops and I actually go make patient contact and render their emergency medical care right there and then transport them, whether that be towards the hospital or whether that be from the hospital discharged into a nursing facility or a rehab facility. I also wanted to discuss about how we can go about as medical providers, or the next generation of maybe physicians, NPs, nurses, how we can conceptualize AI, and as we break the accountability barrier, so to say, and the black box, so to say, with our patients when we communicate these things and when we tell them about the regimens and the care that we actually can provide, because I think Dr. Turley mentioned many counts.
So are you asking about informing patients about the use of AI, or using AI to more effectively communicate with patients?
Using AI to effectively more communicate with them, so that we can also ease some anxiety that they have, that we are using these disruptive technologies and how they can affect them right there and there.
Okay, got it. Yeah. I think.
Go ahead.
Did you have some examples on that, right?
Sure, I'm happy to. First of all, thank you for your service. That's a great job that
My pleasure. Please.
Absolutely. I think, from all of our experiences with online, generative AI, you can see that basically there's a wealth of examples where these kind of tools that is a very good example of something that they can do well, which is change the tone of how something is written, or create it in a way that's more specific to a particular reception. And so there's definitely a lot of possibility for that, and I think it would be wonderful to see that in use in conjunction with, how emergency responders or others kind of act, day-to-day live with their patients. Others might have seen that as well. Yes.
I think a great example is the latest AirPods Pro that connect to your phone, do real-time translation. So it's like Star Trek style universal communicator, and you can have a conversation with somebody who's speaking a different language, and your AirPods will translate, and you'll hear it in your language. and your phone will broadcast the audio to them in their language. And as was said, our physicians who are using AI now to create patient-friendly discharge summaries, patient-friendly radiology reports, and we can tune those. We could say that the patient's primary language is Spanish and that their reading level's at the 5th grade. If you were to ask us as humans, even if we could communicate with patients well, we would be limited in our ability to adapt to those different perspectives. So I think that it's going to dramatically improve that situation if used well and securely, but huge opportunity.
And the second part of my question, actually, I'm so sorry.
I'm so sorry if it's okay. We have a lot of people lined
No
up.
problem
We
at
have
all.
a
No
few
problem.
questions.
Thank you.
If it's okay, thank you very much. I appreciate your question. I'm going to go to you, and if it's okay, we're going to take one last question from here because I'm seeing our clock down and some signals from Naja. So.
Hello, everyone. Thank you for speaking today. My name is Camila. I'm a recent graduate of the NYU School of Global Public Health. And I was just wondering, Dr. Triola, you mentioned precision education using AI in medical training, which I found really fascinating. I'm curious how medical schools are preparing to deal with challenges like AI hallucinations or sycophancy, considering the critical impact inaccurate or biased information could have on clinical decision-making.
So AI, here at NYU Grossman School of Medicine, AI is part of our core curriculum from day one of medical school. We have a formal, progressive curriculum in AI. We're making it up as we go along because during the 3 years of medical school, AI is changing dramatically. Each year, we take the students through simulations that we call promptathons, where the students are given sample cases and text. Some of those things are designed to trick the AI into hallucinating, and we ask the students to see that, or produce inaccurate medical information and guidance. And as was said before, our goal right now is for them to understand the vocabulary, understand the potential, and to be discriminating consumers of the output of AI. We also are giving our students access to all of the clinical AI tools that our residents in training and our faculty, physicians and nurses have access to. So when they're seeing patients, they have access to a lot of these different tools. But for our students, we're not turning on all of the features. We're not letting them drive a car before riding the bike. So the AI won't help them as much as it will help that expert physician who knows how to do it, forcing them to practice and learn this skill, and then as they go through, it helps them more and more as they learn. But I welcome suggestions because we are all trying to figure out how to both train about this and figure out what work is going to look like for a physician 10 years from now to best prepare them for the world they're entering.
Thank you very much. We're going to have one last question, and my sincere apologies to everybody else. We're going to come to you, sir.
Hello. Thank you so much for the insightful talk. My name is Julian. I'm an undergraduate student studying public health. And so a lot of my background research has been on how social media has affected developmental attention and learning in the young generation, my generation, Gen Z. And so, there's a saying, life is about the journey and not the destination. However, with AI, you pretty much go straight to the destination, right? And so you miss out that entire part where you're able to critically think. And so before, and social media has been around for a long time. Now countries like Australia and some countries in Europe are installing pretty much laws and restrictions on some students not being able to use it after seeing over a course of a decade how the negative effects of social media is ruining the new generation. Do you believe that the same thing, and I know a similar question's been asked about AI pretty much ruining or hampering the attention span and the learning environment for Gen Z? Like MIT did a study where they showed 83% of the people using AI were not able to recall facts from an assignment that they just finished, and resulting in a 32% lower cognitive load. Do you think that there should be policies or state laws or something like that put in place to limit AI use at all?
Yeah, that's a great ending. That is a great ending. Our panelists have been very, very generous. Thank you so much. It's really been wonderful to be with all of you. But our panelists have provided a tremendous amount of resources for us. If you capture the QR code, it'll take you to a page similar to what you see on the right of the image. And there you will have links to expanded things that everybody discussed today.
But
that
if I
think
could,
would be
I did
valuable.
want
Go
to, so I don't want over-regulation. I don't want policies to get into this. But it is our responsibility, right? Higher education to guide us through this turbulent adolescence of a societal transformational change. You as faculty, as conscientious students, it is our job to intentionally navigate this. And there will be lots of turbulence as part of that navigation. There will be a real disruption of etiquette and what's appropriate. And a lot of the side effects that I think we're seeing, like from that MIT study, is just from us not knowing how to use these tools effectively or correctly. And we're going to figure that out. But I think to stunt or diminish what is truly one of the most magical inventions, and in any way limit people's access to it, would be doing a huge disservice to the advancement of our culture and our whole existence on this planet. So I say full speed ahead.
And I would also say that the policymakers will not be Gen Zs, so it would be best not to have policymakers that would actually limit it, because they would be significantly older, they would not be users of the product, and so they would put strict limitations on its use, and I think it'll just hold the system significantly, if I could add my 2 cents on that too. Okay?
Great points. Thank you.
Last but not least, not only I want to thank the panel, I also want to thank our alumni, our attendees, some students that I know are in the group, and most importantly, our NYU alumni directors of all 5 schools that have really tremendously helped in putting tonight's panel together, and it's been an honor to have you with us. Thank you very much. Have a great evening. Thank you.